What do you do with your incision after surgery? And when you wake up from surgery, you're going to have a dressing on there, and it looks like a big Band-Aid. That stays on for a week. And the questions always come, well, you peel that Band-Aid off, and then what? Not all incisions are closed the same. For the most part, there's going to be one of two situations. One, and this is the vast majority of the time, you're just going to see a little strip of glue over the incision. When that's the case, there's nothing to do. You want to leave it clean and dry. You want it to dry up. Okay, a dry wound in this case is a good wound. It's okay to shower, let the water run on it, pat it dry, but then leave it dry. Really try to avoid putting anything on it. The second situation where this is even more important is if you look at, and there are maybe sutures in the wound. In those situations, even more importantly, to not put lotions, creams, ointments, anything on it. We've had a number of people lately who have been trying to be proactive, and I think it's very good. And it makes kind of sense, maybe intuitively, that putting an antibacterial ointment might be a good thing. But after surgery, we really would encourage you not to do that. If we need something like that, we'll prescribe it and we'll get it to you. There's no question about it. But otherwise, leave it dry. Then when you come back and see us, we can talk about when the right time to start using lotions and ointments and things like that could be to kind of help soften the skin.